chronic kidney disease? The symptoms, diagnostic tests, and treatment options. Your kidney is a vital organ in your body. It is responsible for filtering out excess fluid and waste materials from your blood, which helps to maintain the balance of fluids and minerals in your body. Kidneys also regulate electrolytes and produce hormones that help with blood pressure. When kidneys don't work properly, it can lead to a variety of issues including chronic kidney disease, CKD. CKD is an umbrella term that describes any kind of chronic health condition that causes damage to your kidneys. The most common form of CKD is called chronic glomerulonephritis, CGN, which causes inflammation of the filters in the kidneys. If you find yourself suffering from this condition, there are several treatments available that can help alleviate the symptoms. Keep reading to learn more about chronic kidney disease, its symptoms, diagnostic tests, and treatment options. What is chronic kidney disease? Chronic kidney disease is a term used to describe any kind of chronic health condition that causes damage to your kidneys. The most common form of CKD is called chronic glomerulonephritis, which causes inflammation in the filters in the kidneys. If you have CGN, your kidneys will leak protein into your urine and it will be hard for you to urinate. In many cases, CKD progresses slowly and symptoms don't usually start until at least half of the kidney has been damaged. However, in some cases, symptoms can develop rapidly if the glomerulus gets blocked by a blood clot or another type of blockage. Ultimately, this can lead to kidney failure and make life difficult without proper treatment. Before we go on, like and subscribe to my YouTube channel for more awesome videos. Symptoms of chronic kidney disease. A wide range of symptoms can be a sign that you have chronic kidney disease. Some of the most common symptoms are abnormal urination, feeling tired all the time, anemia, low red blood cells, high blood pressure, swollen feet or ankles, decreased appetite, itchy skin. Diagnostic tests for chronic kidney disease. The first step in understanding if you have chronic kidney disease is to perform diagnostic tests. There are two main types of diagnostic tests that can help detect CKD: imaging tests and lab tests. Lab tests are typically the first step in diagnosing CKD. They measure levels of creatinine, blood urea nitrogen, BUN, and albumin in the bloodstream, which will help your doctor determine if your kidneys are functioning properly. Imaging tests like an ultrasound or CT scan can also be used to diagnose kidney damage. One common type of imaging test is called a renal ultrasound, which is performed by inserting a small probe into the body at various points on the body to create an image of the kidneys. The images are then studied by a radiologist to try and detect any abnormalities that might indicate damage to your kidneys. Lab tests can tell whether or not your kidneys are functioning properly, but don't provide any information about what's causing problems with your kidneys in the first place. This is where imaging tests come in. They allow doctors to see what might be causing your problems with your kidneys, even when there's no problem visible on lab results or other signs or symptoms of kidney damage. Treatment options for chronic kidney disease. Sometimes, the symptoms of CKD are not severe enough to warrant treatment. If they persist, however, it is important to seek help in the form of medication or surgery. The most common approach to treating kidney disease is with medications that will reduce inflammation in the body. For some people, this might be enough to maintain their kidney health for years prior to needing a transplant. If the condition becomes more serious and limits your daily life or productivity, there are surgical options available as well. These surgeries can remove parts of the diseased kidneys and replace them with healthy tissue, a procedure called a renal transplant. Knowing more about chronic kidney disease will help you better understand how this health condition affects your body and what steps you should take if you think you're suffering from this debilitating disease. Prevention and management of chronic kidney disease. CGN is the most common type of CKD. It's very likely that you've heard of it, but what is it? CGN is a chronic condition that eventually leads to kidney failure. It first starts by causing inflammation in the filters of your kidneys, called glomeruli. These filters are what clean your blood, so when they're inflamed or damaged, they cannot clean your blood as well as they used to. Eventually, these glomeruli can scar and become permanently damaged, which leads to serious health problems like high blood pressure and anemia. The good news is there are some ways to prevent or delay CKD from getting worse. A healthy diet with plenty of protein and low-sugar foods, regular exercise, managing your weight, limiting alcohol consumption, not smoking cigarettes, these are all great ways to help keep your kidneys healthy. These treatments can also help manage the symptoms of CGN: medication for high blood pressure, medication for anemia, diuretics, ACE inhibitors, blood pressure medication, antibiotics. Conclusion: Chronic kidney disease is a condition in which the kidneys become progressively less able to filter blood and remove waste, and is most often associated with diabetes and high blood pressure. Symptoms of chronic kidney disease can include fatigue, nausea, weight loss, dizziness, or clouded thinking. Diagnostic tests for chronic kidney disease may include a complete blood count, urinalysis, and urine protein levels. Treatment options for chronic kidney disease will depend on the severity of the disease and may include dietary changes, medications, or podiatry. Prevention and management of chronic kidney disease includes identifying and treating any contributing factors such as high blood pressure or diabetes at the earliest sign. Don't forget to like and subscribe to my YouTube channel for more awesome videos like this.